I've had so many of my fifth graders that tell me, I've had headaches. And they don't want to tell their parents because their parents will tell them, well, we're not going to go to the doctor because they don't have the money or other reasons.
It's suffered in private, and it will cause them to check out. School's not for me. I'm not good at this. The negative self-talk starts.
These are kids. They're, pre-K through, in some cases, high school. They're in rural areas. They don't have access to good health care. And in many cases, they've never had an eye exam before.
Many parents, certainly in our part of the state, just don't have the financial resources or the insurance coverage to take their child to an optometrist or an optician. And if students can't see, they have difficulty learning.
And a lot of them don't want to tell you they need to sit in the front of the room because they're embarrassed. So it's just noticing the small things about a kid that's leaning forward or has something directly in front of their face.
If they've grown up with a bad vision, they don't have a perspective to know that it can be better.
The principal said to us, we don't have any vision resources. If you know of anything, we'll take any help we can get. So I said, I'll reach out to Peach State and see what I can do.
Peach State Health Plan is part of the community. We have employees who are in the communities. We serve the communities we live in.
I just had a contact at Peach State, and I emailed them and said, hey, is there any way we can do a vision clinic again? And that contact put me in with Maria.
We've done many of these events across Georgia before COVID. We came back out after COVID. We were just in Thomasville, Georgia last month. And so this is an initiative that's near and dear to my heart and important to us as an organization.
So Maria contacted me, and she had funding to go ahead and do it.
And Cassie reached out to me and said, guess what? They're going to come again in December. And I announced it at a faculty meeting, and the crowd went wild. Like shouts, claps. It was like the teachers won the lottery.
Peach State provides the van and the eye professionals. And what makes it work is that every organization is focused on helping children. It is a huge collaborative effort. It takes a commitment from the school system to take the kids out of the class. It takes the teachers to help doing the support that they have. Our organization pays the salary of our staff to help manage the whole process.
The process is pretty simple, but there are a lot of logistics. First, we have a consent form that the parents and guardians need to sign so that the student can be seen for screening. Then we bring them in and they're screened. If they need to be seen by the doctor, then they're taken to the vision van. They pick out frames, we help them with that. Then we send some notice back to their parents and guardians to let them know what the results of that test were, if they're going to be receiving eyeglasses or if they have good vision. And if they need prescription eyeglasses, then we provide those at no cost to them.
Just place your chin on this bar, just place your hands on the table.
I'm not sure that the kids understand what's going on when they get in line and get an eye test. However, when they do receive the glasses, the smiles on their faces are just so rewarding. Then those kids know.
You watch them on the bus with the eye doctor, and when he's doing their exams, he'll ask them, can you see that? Can you see that? They say, no, no. And then when he gets the right lenses in front of their eyes, their smile just lights up.
One young man, he was almost legally blind. He tried several pairs on, and he knew the ones he wanted. As soon as he tried them on, his face lit up, and with a huge, huge smile. And he looked at me, he said, thank you, thank you.
I promise it's appreciated. You could go see some of my fifth graders. He already showed me he was showing me his little slip. He was so excited, and he's like, I need glasses. I'm like, I knew you needed glasses. I could tell that you needed glasses. But his family would not have taken him. I was like, imagine how much better you're gonna be able to see the soccer ball now. That you'll be even better, and you're not gonna have to get right in front of the board or hold a computer screen directly to your face. So it makes a difference.
One specific situation where a child couldn't see and his parents didn't have the ability to get an exam, which was needed before they could do an evaluation for his learning disability. And so as a result of screenings like this, we were able to provide free corrective lenses for them so that now that child will be able to learn and is in an appropriate place in the school system.
We were able to determine one kindergartner who's not been able to see an eye doctor that she's going to need some glasses, and we're going to be able to speed this RTI process up for her so she can learn to read and write and get the extra supports that she needs that she's not getting right now because vision was an issue until today.
I couldn't imagine being in high school, being 17 years old, and not being able to see. I myself have to wear contacts and glasses, and I cannot see without them. I can't drive without them. So to give them that service at such a young age 100% saves their life, it saves their education, it saves their future.
We expect attendance to be better because if they can see and they're excited about school, you're going to come to school, so we're expecting big things, big results.
I think they're going to be seen, not just being able to see, but they're going to realize that someone else saw them, that someone acknowledged them. And a lot of times that's all a kid wants is to be seen.
I feel so privileged to be able to represent Peach State Health Plan in these initiatives. We see the impact that our work makes on our members' lives in the community at large. Like the kids that we saw today, they didn't have to be members. They're not Peach State members. It's just a service that we are delivering, we're offering, we're bringing because we know there's a need.
I think it's because of the mission that Peach State has, dedicated to providing good quality care and supporting providers who provide quality outcomes. We couldn't find a better partner than Peach State.
We really appreciate Peach State and everything they do. They've just done an amazing job making sure everything's taken care of. And I hope that they'll continue this program and we can expand it to all of our schools.
We just want them to come back here every other year. I don't think that's too much to ask. That's just what we hope for.